Have you noticed lately that you're holding your phone out here like this? Or do you get fatigued after reading for long periods of time? Does everyone seem to be using smaller print these days? You may just have presbyopia. Presbyopia is a totally natural part of the aging process that makes it difficult to focus on near objects. This happens because the lens inside of the eye becomes more rigid, less flexible over time, and the ciliary muscle that helps the lens to change its shape to focus weakens as well. People typically notice symptoms around age 40 or so, though if you have hyperopia, you may notice these symptoms a little bit earlier. And they progress slowly over time until they stabilize around age 60. Presbyopia happens to everyone. It's not preventable, though healthy lifestyle choices, like for almost all things, can help to slow down the aging process of the lens and help to slow down presbyopia progression or maybe delay the start of the symptoms a little bit. These would be things like avoiding smoking or recreational drug use, keeping a healthy diet to prevent systemic diseases that can cause early aging of the lens, such as diabetes, and wearing sunglasses outside. Now, before we get into talking about treatments, I want to talk about some of the concerns that I've seen people have, not just among my patients, but people who are in my day-to-day life. So there's definitely an emotional aspect to presbyopia. People don't often like to hear that they are aging or that their body is showing signs of aging, even though the process of presbyopia is 100% normal. When I was a student, I had a patient who was 40 or 41, and when I told her she had presbyopia, I thought she would be happy that it was a simple fix. She could have worn just over-the-counter reading glasses, they're inexpensive, and it would have solved her issues and her symptoms. And she actually started crying, and I felt so bad because I knew she was concerned about aging and she just wasn't ready for that kind of information. And so now I try to present it a little bit differently, but there's almost always going to be a little bit of emotional aspect to it. So just something to keep in mind as you watch this video. It's a normal process and we all age and we're all going to go through it. I know that doesn't always make it easier, but it is natural. There are also a lot of people who are in denial about presbyopia. They're holding things further and further away. They might be squinting. They're having eye strain or headaches with near work. But when somebody tells them, hey, why don't you try reading glasses? They're like, oh, no, I'll be fine. But I don't think they realize how simple it is to resolve their symptoms. And maybe they just don't want to face the fact of needing reading glasses, or maybe they think it will be really inconvenient, but it is a really simple solution for a pretty simple problem. I think sometimes what goes along with that is that some people out there think that if they use reading glasses, it's going to make their near vision worse, and that's simply not the case. Sometimes people think they're being proven correctly because they're wearing reading glasses, and over the years they need to increase the power of the reading glasses. But that is actually a 100% normal part of this process. Every 2 years or so, the power in the reading glasses is going to be bumped up because that lens is continuing to age and the ciliary muscles are continuing to weaken little by little. That requires a stronger and stronger power, usually until you hit the add power of over-the-counter readers of about a plus 2.50. So people think that the glasses are making their vision worse, when actually the glasses are just adjusting over time to help the natural process that's going on. One way that may help you to think about it differently is, let's say someone has a broken leg and they're in a cast and they're just trying to get around like that with no help at all. They're going to be really, really tired. They're hopping on one leg. They're going to be exhausted. If somebody hands them a crutch, their life is going to be so much easier, not going to have that pain or strain anymore, and they're going to want to keep using that crutch. This is similar with the glasses. The glasses are helping them to address the problem, make their lives more comfortable, and yes, they're going to want to keep using it, And it's not because they're becoming dependent on it, it's because they've needed it for a while and now they're finally comfortable. So if you're worried about becoming dependent on reading glasses if you start using them, well, it means you probably need them in the first place, and the dependency is because it's helping to resolve the symptoms. Until very recently, there was no way to manage presbyopia other than with glasses and surgery. But the FDA actually approved an eye drop to help manage presbyopia in 2021 called Vuity, and it may be changing the game for some people. Vuity can be used in people with mild to moderate presbyopia, and it can help to improve the vision. And it works by contracting the iris, so it makes the pupil smaller, and by contracting the ciliary muscles, which allows the lens to change shape a little bit. And these things increase the depth of focus of the eye and help to focus light at nearer distances better on the retina. So here's the example of a near card, and you can imagine where you're reading now, how it may improve by 2 or 3 lines. And the goal is to do that without sacrificing much of the distance vision, hopefully only losing 1 line or so at distance. Vuity is dosed once or twice a day. The most common side effects are headaches, ocular redness, and ocular irritation, though there are some more serious possible side effects to consider, like a retinal detachment for those who are possibly more susceptible to retinal detachments, like those with high levels of myopia. They may be advised not to use it, and it can't be taken if you currently have iritis, which is inflammation within the eye. It can also cause some blurriness at distance and some difficulty with night vision because it is making the pupil smaller, allowing in less light. So dim conditions may be difficult to navigate in, and some people may need to avoid driving at night. It may also be difficult to transition between near and distance activities visually. It costs about $80 a month, and it's not covered by insurance because it's not considered a medical necessity. Personally, for myself, if I had presbyopia, I wouldn't use Vuity. For one reason, due to the high cost. The cost of using the drop for a year is similar or possibly more than prescription eyeglasses. And I personally like to be a little bit more conservative with treatments for myself. If I can adjust something by adjusting my lifestyle, I would rather do that than use medication, unless I really absolutely need a medication. But that's just for myself. Every patient needs to be treated as an individual and discuss with their doctor their personal needs and the risks and benefits. So there may be someone out there who Vuity is perfect for, and that might be somebody who at their work, they're needing to do near tasks in all sorts of weird positions, like looking up. I'm thinking of like car mechanics. They struggle with looking through the right part of a bifocal, or with having to take glasses on and off because their hands are full of tools or covered with oil or something, and they can't be transitioning between all of these tasks, and glasses can be really cumbersome. For somebody like that, this could be totally perfect. So it's very individualized, and that's how treatments always should be. So be sure to talk to your doctor about what could be best for you. Using glasses for the treatment of presbyopia is tried and true, and it's been around a really long time, and there are lots of different ways to go about it. So one of the simplest could be if you have really excellent distance vision, all you need to do is simply go to the drugstore and pick up a pair of reading glasses. If you have naturally good vision at distance, or you wear contact lenses for distance, it's pretty simple to go to the drugstore and pick up a pair of reading glasses. And there's actually a pretty simple formula that you can follow along with, and there's lots of different ways to look at it, but basically the rule is around age 40 you start with a +1, and every 2.5 years you increase by 0.25 until around age 55 or so, where you might be at a +250. So for example, if you're 47 years old, a +175 over-the-counter reader might be a good starting point, though this can vary significantly depending on your activities and your working distance. So if you're somebody who's really tall with long arms and you like to read out here, you probably don't need as high of a power. But if you like to do a lot of detailed tasks like crocheting and you need to look up close, a higher power is typically better. Also, whatever your power is at your near reading, which is usually about 40 centimeters, your computer glasses would be about half of that. So if you're using a +2 to read, a computer glass that might work well for you is a +1. But again, it depends a lot on your working distance. Laptops are usually closer than desktop computers, and also some people may need these readers to read music, which could be even a little bit further away. So it's always helpful to take measurements of where you typically work in centimeters and report that to your doctor, and they can help you determine either what reading glass may work best for you or possibly prescription glasses, so you don't need to take these glasses on and off all the time. And now that we're talking about that, let's talk about bifocals. Bifocals come in a lot of different flavors. There are lined bifocals, which has distance above the line and reading below the line. There are lined trifocals, which have distance, a line, computer or mid-range, a line, and then reading. And there are progressives, which slowly progress from distance to near without any visible line. The reason to choose one over the other could depend on a lot of different factors, which is best to discuss with your doctor. A lot of people choose the progressive lenses nowadays simply because of cosmesis, but it can also be helpful if you're doing a large range of activities, or some people just don't like having that line and having that jump from distance to near, though it is something most people are able to adapt to. Also, cost can be a factor, as lined bifocals are less expensive than lined trifocals, and both of those are much less expensive typically than a progressive lens. For contact lenses, there are a few different approaches. One of them would be monovision, where you correct one eye for distance and the other eye for near. There are also a lot of different multifocal lenses out there, and they function in different ways depending on the brand and the lens design. But the easiest way to think about it is that some of them have a center that's a little bit more biased towards distance, and some are a little bit more biased towards near in the center. And they tend to have concentric circles of slowly varying powers, so that depending on the situation, your pupil size, and what you're trying to focus on, a different part of the lens will be used to focus the light on the retina, and your brain actually does a pretty good job of learning which image to pay attention to and how to adapt to these lenses, though it really varies depending on the person. Vision in multifocal contact lenses can sometimes be limited. In a lot of cases, it doesn't get quite as clear as it would with glasses. And that's because with a progressive lens, for example, you can get clear vision at all different distances by looking through the correct part of the lens. But in a multifocal contact, the lens is stable on your eye, so you're always looking through the same part of the lens. The success of multifocal lenses can also depend on your environment. In dim lighting, for example, your pupil is larger, and so it's not going to be constricted and giving you the best possible view through that near part of the lens. So it is difficult to duplicate what we're able to accomplish with glasses in contact lenses. Modern contact lens technology does a great job of maximizing vision at near without sacrificing much at distance, but there almost always is going to be a little bit of give and take, especially if you have more advanced presbyopia. And there may always be limits based on what distance you are looking at, what the lighting situations are, what activities you're doing, things like that. So it's important to keep that in mind if you're choosing to get a multifocal contact lens, and to discuss your expectations with your doctor so you guys can best manage your expectations and what you're trying to get out of the lens and choose the best option for you. There are even multifocal lenses available that correct for astigmatism. There are also those rigid gas permeable contact lenses available, and some of the designs of these lenses do allow slight movement depending on whether you're looking at distance or near, and they may work a little bit better for some people rather than others. And they do allow that transition from focusing at distance to focusing at near, though I haven't seen these all that commonly used. It is worth noting that contact lenses for presbyopia can be a little bit expensive because they're not considered medically necessary. So it's typically a totally out-of-pocket expense for a patient unless there is vision insurance that has really good contact lens coverage. But there usually will be some sort of fee for the contact lens fitting by the doctor, and then the annual supply of contact lenses as well. So that's something to keep in mind. It may end up around the cost of the Vuity eye drops for the year, or maybe a little less, maybe a little more, depending on what lens you're fit into. There are surgical options to correct for presbyopia, and one of them is monovision, LASIK, or PRK, which is where you would correct one eye for distance and one eye for near. But this depends heavily on the health of the eye and the stability of the eye. So if you just started experiencing presbyopia at age 40, you would expect this to change slowly over time over the next 2 decades or so. So the eye won't be stable to permanently change the prescription of that eye. And you would need to make sure everything else in the eye is healthy in terms of retinal health, like no macular degeneration. Sometimes glaucoma could be a contraindication depending on the patient. The health of the eye is really important when determining whether or not to have LASIK. Dry eye could be a contraindication to surgery, as well as any retinal diseases or other diagnoses. So I haven't personally seen this procedure done to correct presbyopia, but it is an option for those cases of very healthy eyes that are very stable. This would also be a high-cost procedure that would be fully out of pocket because it is not considered medically necessary. Another way to correct presbyopia surgically would be with clear lens extraction. So this is similar to cataract surgery in that the lens of the eye is removed and it's replaced with a intraocular lens implant with a particular power that you can choose with your doctor. That's how it would be used to correct the near vision, as well as distance at the same time. But unlike cataract surgery, the lens in this case would be relatively clear. So you wouldn't yet qualify for cataract surgery, so it would be considered an elective procedure, therefore not medically necessary, and would be fully out of pocket. There are many intraocular lens implant options that are available that can correct your vision in a variety of ways, and I have a video where I talked about all of those options here. And even though that video is directed more towards people who have cataracts and are interested in cataract surgery, all of the lens options that I discussed are the same. Corneal inlays are another surgical option in which a lens is implanted actually into the cornea. And this lens refracts light differently and improves depth of focus. So it aims to improve near and intermediate vision with minimal sacrifice on distance vision. There are different lens implant designs available, kind of like there are for the multifocal contacts. The management for presbyopia runs the gamut, but by far the most common way to manage reduced near vision is with glasses in one form or another. Though there are a lot of emotional aspects to keep in mind here, presbyopia is a simple diagnosis that is easily managed and happens to literally everyone at some point. I hope that's a bit of a consolation and that learning more about it has helped to bring you some peace of mind. Thank you so much for watching, and I hope to see you next time.